Bismillahirrahmanirrahim. Today the topic and a discussion is the arches of foot. Arches is basically this shape of the foot, how it is maintained, and what are the three main arches. There are three main arches that are recognized in the foot, and they are termed as medial longitudinal arch, lateral longitudinal arch, and transverse arch. These arches are very important, not only from the viva point of view but also from the written point of view. Okay, and the role of these arches is that they are very important in standing, walking, moving, and running. In every case, these are the arches which are basically support the foot. So first of all, we are going towards the medial longitudinal arch. Definitely medial means that it should be on the medial side of the foot. So this is the medial side of the foot. I have maintained it. So the things which I have to cover in the arches is that which are the bones that are involved in medial longitudinal arch, what are the pillars, posterior and anterior pillars, and what are the stability factor or maintaining factor that will maintain these arches like this. Okay, so the medial margin of the foot arches up between the heel proximity and the medial three metatarsophalangeal joints. Okay, they form a visible arch. You can see they form a visible arch which is called as medial longitudinal arch. The bones which are involved in medial longitudinal arch are made up of calcaneum, head of the talus, then navicular, then three cuneiforms. Okay, the three cuneiforms are means all the cuneiforms are involved in that. Then medial three metatarsals. They combine together to form an arch which is called as medial longitudinal arch. Again, I am repeating, the bones that are involved in medial longitudinal arch is the calcaneum, head of the talus, navicular, three cuneiforms, medial, intermediate, and lateral, and the medial three metatarsals. These are all together forming an arch which is called as medial longitudinal arch. Now, what are the pillars? The pillars are the posterior pillar and anterior pillar upon which these arches are built. This is the posterior pillar and this one is the anterior pillar. The posterior pillar is formed by the inferior calcaneal surface. You can see this is the inferior calcaneal surface. It's forming the posterior pillar. And then the anterior pillar. Anterior pillar is formed by the three metatarsal heads. Okay, the heads of the three metatarsals forming, these are the heads of the three metatarsals. These are forming the anterior pillars. So the posterior anterior pillars are the posterior part of the inferior calcaneal surface, and the anterior pillar is formed by the heads of the metatarsal. Now, what are the contributing factors which form these arches, in which the important thing is the ligaments. Ligaments take part a very important role and give stability to these arches. One thing which is first one is the thing which we give support to this medial longitudinal arch is the plantar epineurosis. Plantar epineurosis act as a beam between the supporting pillars. Okay, when we do dorsiflexion, it draws the two pillars together. Okay, so the important thing is that we have to remember that the plantar epineurosis is an important part that taking part in the stability of the medial longitudinal arch. Second thing is the spring ligament. Okay, we all should know, and I think so Dr. Riaz told in his lecture that spring ligament is very important ligament which basically fills the gap between the calcaneum and the navicular. Okay, from the calcaneum, it attaches from the sustentacular tali of the calcaneum to the medial plantar surface of the navicular. यहाँ से लेके यहाँ तक ये ligament जाता है, ठीक है, and its superior surface is covered with the synovial membrane which also supports the talus head. So this ligament is very important and it supports the head of the talus. Okay, in case of any trauma, if this ligament fails, the navicular and calcaneal, they separate, and they along the talar head, which is the highest point on the arch, it will become descend down. Okay, this is the highest point on the medial longitudinal arch. You can see this is the talar head. So in case of any disruption to this ligament, तो it will causes the talar head to become descend down. ठीक है. The third thing important in this stability is the talocalcaneal ligaments. ठीक है. Talocalcaneal ligaments are also important and they also causes this stability. They comes from the talus to the calcaneum. There are also anterior fibers of the deltoid ligament. There is what is the deltoid ligament? Deltoid ligament is also a strong flat triangular band which attaches above to the apex and anterior and posterior border of the medial malleolus. Okay, this is medial malleolus. It comes from the anterior posterior borders and it will basically attaches over the talus, and this ligament is also very important in maintaining the medial longitudinal arch. So the stability factors that are important are the plantar epineurosis, spring ligaments, talocalcaneal ligaments, deltoid ligament. They all give stability or maintenance to the medial longitudinal arch. Muscles also play a role in the maintenance of medial longitudinal arch, like flexor hallucis longus, okay, flexor digitorum longus, abductor hallucis, and medial half of the flexor digitorum brevis. They also contribute. Okay, these names of the muscles you should know. Okay, tibialis posterior and anterior invert and adduct the foot. Okay, and they also help to raise its medial border. So these are just name of the muscles which you should know in case of stability of the medial longitudinal arch. Now we are going towards the lateral longitudinal arch. Definitely medial was on the medial side, so we now moving the foot into another direction. Now this one is the big toe. So this is the lateral side of the foot, and the lateral side of the foot has the lateral longitudinal arch. The lateral longitudinal arch is much less pronounced arch than the medial one. आपको नज़र आ रही है कि थोड़ा सा कम है बनिस्बत medial side के, इतना ज़्यादा बहुत ज़्यादा arch नहीं होती. ठीक है. उसी तरीके से the bones which are making up the lateral longitudinal arch, we remember these bones. This is the calcaneum. Again calcaneum इसमें भी add on होगी, उसमें भी थी, इसमें भी है. ठीक है. Calcaneum, then in front of the calcaneum cuboid and fourth and fifth metatarsals. They can contribute to the arch in terms of stability. Okay, the calcaneum, cuboid and lateral two or we can say fourth and fifth metatarsals. Okay, medial जो थी वो medial longitudinal arch में थी और lateral वाली जो two हैं they are important in the lateral longitudinal arch. So they are forming the lateral longitudinal arch. They contribute little to the arch in terms of stability, but they are involved in that. Now the pillars. There are posterior pillar and the anterior pillar. The pillars are the calcaneum posteriorly, similarly. ठीक है, calcaneum posteriorly and the lateral two, these one metatarsals are forming the anterior pillar. Okay. उसी तरीके से posterior pillar बताना है और anterior pillar बताना है. Posterior pillar by the calcaneum and anterior pillar by the lateral two or the fourth and fifth metatarsals. Now the stability factors. Number one is similarly the ligaments. Ligaments play a very important role in stabilization of the arches, especially the lateral part of the plantar epineurosis. Okay, again the plantar epineurosis is important, but the lateral part gives more strength to this lateral longitudinal arch. And there are also important long and short plantar ligaments. Okay. However, the most important contribution to the maintenance of the lateral arch is made up of tendons of Fibularis longus. I have told you Fibularis longus comes from this side, okay, and then it moves from the calcaneum and it goes from inside and then attaches over the first metatarsal. So at that point, it gives so much strength to the lateral longitudinal arch. So the important thing is that the lateral part of plantar epineurosis as well as the peroneus longus or fibularis longus is also very important muscle which give importance or maintenance stability to this lateral longitudinal arch. Along with these, the two tendons of flexor digitorum longus, okay, flexor digitorum longus, and the muscles of first layer and Fibularis brevis and peritoneus tertius also contribute to maintenance of lateral longitudinal arch. But be remember this thing कि जो muscles of first layer हैं वो भी involve होते हैं, वो आपको next lecture में बताएंगे कि वो कौन से होते हैं. So but you have to remember that which are the muscles which also maintain the lateral longitudinal along with the ligaments. So this was about the lateral longitudinal arch. Okay, the things which we have to cover are the bones that are making the arch, the supporting pillars, and what are the stability factors. Okay, so now come on towards the transverse arch. Okay, the third one is the transverse arch, and we know that transverse arch is formed definitely in this direction here in between. Okay, so transverse arch is a third arch which is important in foot. It is the bone that are involved in transverse are the bases of the five metatarsals. These are the bases. So these are the bases of the five metatarsals along with the cuboid and cuneiforms. Okay, this cuboid, cuneiforms, and the five metatarsal bases of the five metatarsal combine together to form a transverse arch. Okay, the metatarsal and lateral the intermediate and lateral cuneiforms are basically wedge shaped. Okay, this one is the intermediate and the lateral. These cuneiform basically are wedge shaped and they adapt the maintenance of these arches. Okay, these two are very important maintaining factors in the transverse arch. Then the stability of the arch is mainly provided by ligaments. In between these all there are smaller ligaments, ठीक है, which are आपको हर एक का नाम याद करना है, उसकी attachment इतनी ज़रूरी नहीं है, लेकिन but you should know that there are some interbony ligaments which basically bind the cuneiforms and the metatarsal, and also by the tendons of they are also attaches with the tendons of the fibularis longus, which tends to approximate the medial and lateral borders of the foot so that they maintain this structure of or this transverse arch. Okay, a shallow arch is maintained at the metatarsal heads by the deep transverse ligaments. Okay, यहाँ पे head of metatarsal पे deep transverse ligaments होते हैं. Okay, transverse fibers that bind together the digital slips of the plantar epineurosis and to a lesser extent by the transverse head of the adductor hallucis. These are all the things which are also involved in maintaining the transverse arch. But at this point, you should know the bones, the supporting pillars, and along with the stability factors. This was the transverse arch. If these arches are lost, for example, ये जो आपको arch medial longitudinal नज़र आ रही है, in some people this is basically lost, or we have seen some people who have flat foot, not these this is this like arched foot, they have flat foot. तो flat foot क्या होता है? Flat foot is basically the postural deformity in which the arches of foot are basically collapsed with entire sole of the foot coming into complete or near complete contact with the ground. Okay, it's like this, and the drawback of that flat foot is that person cannot move fastly, he cannot run fastly. These arches basically support when the person is about to move, just he have to put up his calcaneum and just he start walking, or he can start running. But in case of flat foot, when the arches are lost, the problem is this कि होता क्या है कि वो अपनी पहले कैल्केनियम उठाएगा, फिर नेक्स्ट क्या कहते हैं उसे नेविकुलर, फिर क्यूनिफॉर्म्स, और वो उठाते उठाते उसको इतना टाइम लग जाएगा कि ही कैन नॉट रन. भाग तो लेगा लेकिन he cannot run fastly. Okay, he cannot move fastly. So flat foot is termed as is basically considered as a postural deformity in which these arches become collapse. So you should remember this thing as well. बाकी जो ये बोन्स मैंने आपको करवाई थी कैल्केनियम, टेलस, उनमें से यही दोनों ज़्यादा इंपॉर्टेंट है. बाकी बोन्स आपको बस नाम याद होने चाहिए, इंटरलिगामेंट स्ट्रक्चर्स पता होने चाहिए, इनकी पोजीशंस, और बाकी जो ये मेटाटार्सल्स के हेड, बेसिस, शैफ्ट्स. This was whole about the foot bony skeleton along with the arches.